So you've decided to go with a Medicare Medigap policy. Now the question is, which plan do you choose? My name is Stephen, and I'm with Strategic Estate Planning Services, and that's what I'm going to help you do to decide today. Which plan is a good plan when you're dealing with Medicare supplement policies? By the way, if you haven't figured this out yet, it will be helpful to know that supplement or Medicare supplement policies and Medigap policies, they are one and the same. They're just two terms for the same product. So to understand which plan to choose and which one might be good for you, let's talk a little bit about some of the differences and what they're designed to do. So first, let's start with the idea that Medicare itself, Part A and Part B, what is known as Original Medicare, was never designed to be comprehensive coverage. It was designed to cover most of your medical bills or hospital bills, but not 100%. So that left gaps within the coverage. And the insurance companies and the insurance industry decided that they will design products to fill those gaps, and that's why we call them Medigap policies. Of course, somewhere early in the process, the federal government decided to standardize these policies. So you have today about 10 different versions of Medigap plans, and that's what they're called. They're called plans. Now, how do you know which plan does what? Is there any descriptive terminology within the name of the plan to give you a clue? Nope. The plans are known as Plan A, Plan B, Plan N, Plan K. So the names themselves aren't very helpful. But out of the 10 plans that are offered and standardized in most states, some states do have some exceptions. I narrow it down to basically 3 plans that I believe are worth looking into. And for many of my clients, they actually agree with me and really boil it down to one plan that's most likely going to be a good fit for you. So what you're looking to do is, with the supplement policies or with the Medicare Medigap policies, you're looking to fill in those gaps that Medicare doesn't cover, such as the 20% coinsurance on Part B, or the deductible on hospitalization. All these kinds of things are out-of-pocket expenses to you that you're responsible for if you don't have some kind of supplemental policy. But here's the deal. All these different insurance companies that are out there marketing Medicare policies, Medicare supplement policies, they have to follow the federal guidelines on the standardization. So if you buy a Plan G from one carrier and compare it to a Plan G from another carrier, you're going to find that it's the exact same coverage. They can't be different. So the difference is in how much they cost. But before we get to that, let me review what I think are 3 plans that you should take a closer look at. The first one is Plan N, as in Nancy. So Plan N, as in Nancy, is a good solid supplement plan that covers most of the gaps. But there's a few gaps that are not covered that I think are worth paying attention to. Number one is Plan N has a copay. So when you go to your doctor or to a specialist, most likely they're going to charge you a $20 copay for every visit. So that's an out-of-pocket expense that is part and parcel with the policy that you choose. All right, so another one of the gaps to be mindful of is the what's called the excess charge. So it can get complicated to explain what the excess charge is, but if you look at the charts on any of the Medicare publications, you're going to see that there's what they call the excess charge, and it's a 15% allowance that certain providers are able to charge above the Medicare approved amount. So that's really the nuts and bolts of it, is Medicare has certain guidelines on what they can, a dollar amount that can be approved. And for certain providers, not all providers, but certain ones are allowed to charge 15% above that. Plan N, the supplement Plan N, does not cover that 15% excess charge. You will be responsible to cover that if you have a Plan N. Whereas Plan G, as in guy or girl, covers that 15% excess charge. So even if the provider you go to or the doctor you go to decides to tack on that excess charge, you'll never see it because it's covered by the supplement plan itself. So that, I would say, is the two biggest differences between Plan N and Plan G. Plan N has a $20 copay that's associated with the provider visit, and it also does not cover that excess charge, whereas Plan G does not have a 20% copay, and it does not, or actually does cover the 15% excess charge. Which one of those plans is probably going to be more expensive in premiums? If you said Plan G, you were correct, because Plan G has better coverage in that sense and is, of course, priced accordingly. So if you're really sensitive to premium cost and you want to save a little bit of money, and let's say you're really good health, so going to a doctor and paying $20, because you only go once or twice a year, no big deal, well, then you can save some premium dollars by getting a Plan N over a Plan G. But just be aware that not only do you have to deal with that $20 copay, but you also have to deal with that excess charge. The third plan that I think is worth considering is Plan G high deductible. So it's just like Plan G, except in exchange for a lower premium, you have a higher dollar amount for a deductible. So they call it a high deductible Plan G. It's over a couple $1,000s a year. Again, great for people who are price sensitive to the premiums and who are pretty healthy, most likely not going to ever need to meet that deductible. That may be worth considering. But most of my clients, and I've been doing this for many years, most of my clients, when I unpack it all, they default to Plan G. If you have a Plan G, the only out-of-pocket expense that you have to contend with on an annual basis is the $203 annual deductible. Now, I want to make note that that annual deductible is not set by the insurance carriers. That annual deductible is determined by Congress, and they update those kinds of things on an annual basis. So we'll find out sometime, usually in November, what the deductible will be for the following year. You have no control over it. The insurance companies have no control over it. It is set by Congress as part of Medicare itself. So that is the summary of what I would say you need to look at when you're choosing a plan. Rather than trying to wrestle through all 10 versions, in my opinion, I would narrow it down for you between Plan G, high deductible Plan G, and Plan N. And again, most likely Plan G is going to be found to be a good fit for you. The only other thing I want to mention in this video as we wrap up here is once you determine what plan you want, then you have to determine what insurance carrier to get the plan from. And when we already talked about that, it's exactly the same no matter what insurance company you buy it from. So then what's the difference? Well, the difference is cost. And Medicare wants to drive that point home to you. If you ever come across one of these Choosing a Medigap Policy publications put out by Medicare, on page 9, at least in this year's version, it says cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. And they put that in bold, and they highlight it in blue, so it really stands out. They want you to know that the only difference between different carriers offering the same plan is cost and premiums. Now, if that wasn't enough, they repeat it again on page 19 in bold letters. There can be big differences in the premiums that different insurance companies charge for exactly the same coverage. So when you're shopping around, I'm not saying that it doesn't matter what insurance carrier you choose. I'm just saying really the only thing that matters is the pricing point of the premiums. So there again, there's lots of different options. There's many carriers in this game that want to sell you policies. And my job as an agent is to help you decide which insurance company is going to bring the value that you need of course, in helping you walk through those different plan options. But once you decide the plan, figuring out what insurance company, that's not too hard to do. Work with a good agent. If you want to work with us, we'll be happy to serve you in that way. So if we can be of any help at all to you in this regard, please call our office at 1-800-381-8870. Hi, wanted to make a quick disclaimer added to the preceding video. In the video that you just watched, I talked about 10 different versions or standardized versions of Medigap policies, Medicare supplement policies. And we just wanted to make sure that we're not giving any misleading or false information. You should consider all of your options. I talked in the video about how my conversations with clients generally go and where they end up, but that may not be what's best for you. So you need to talk to your agent about reviewing all of your options and do your own research. Any of the 10 supplements, if you choose to go with a supplement, any of them might be right for you and might be best. The other thing I want to make sure is understood is that I in no way work for Medicare or any government agency. I'm a licensed independent sales agent, and so when I present these videos to you, you need to consider that. And any videos you watch about Medicare or any information, you need to consider the source that it's coming from. And of course, do your own due diligence to make sure that you understand their viewpoint and their biases. So hopefully that brings clarity. And we wish you the best. Call us if we can help you. Bye-bye. Thanks for watching our video. We want to make sure that we draw your attention to other videos that we have, and we encourage you to subscribe to our channel. On our channel, we have more than just Medicare videos. We also have a playlist, Strategic Money Tips. They cover other areas that are very practical. We try to keep them very brief. Go to our YouTube channel, subscribe, click on notifications button so that you'll be notified when we put out a new video. But if we could serve you directly, please call our office, 1-800-381-8870, and visit us on our website at strategic estateplanning.com.